All right, let's take you back to one of our other stories that we're watching unfolding in Sandton at this hour. That's where the Hospital Association of South Africa is hosting its annual conference under the theme Innovation and the Future of Healthcare Provision. The gathering brings together healthcare professionals, policymakers and industry leaders to try and explore new technologies, policies and partnerships that are shaping the country's health system. Watching that story for us is SABC News Reporter Katlego Legodi, who is joining us now live from Sandton. And Katlego, I'm not sure if you're able to hear us. If you are, I'm sure there are a number of stakeholders who have been heard at that particular gathering. Help us place what kind of discussions are taking place and what the possible outcomes of this gathering will be.
A very good morning to you once again, Ayanda. Welcome back to the Sandton Convention Center. This is where we see those high-level conversations continuing this morning well into the afternoon, giving us a sense of where we find ourselves as a country to date in the provision of healthcare, adequate healthcare. So HASA, the Hospital Associations of South Africa, is actually 17 years old. And Ayanda, they've been doing this work in, year out, gathering think tanks within this space to really just outline certain issues that they pick up on a daily in their area of work, but also just try by all means to prepare the future of the country where healthcare provision is concerned. So various of those conversations already coming under the spotlight, the NHI, where we find ourselves today in terms of the implementation, the rollout. There is a litigation in place around that from HASA to the government. At the same time, we know very well that there's an issue around funding, there's an issue of infrastructure development, and a lot of issues that would speak to where we find ourselves. How do we harness technology, for instance, in ensuring that we solve for the country's healthcare sector? The person that is well vested with all of these things that I was speaking to you on now would be Melanie Costa. Melanie joining us this morning as the chairperson, the chairman of HASA. And here we see you gathering various of these role players once again in the year 2025 to thresh out various of these issues. Maybe let's start by just reflecting on the work of HASA. For those that don't know this organization, let's reflect on what you guys do, Melanie, and how we find you gathering these role players here today.
Thanks, Katlego, and I appreciate the opportunity to engage with you. So HASA really works on policy matters. It's an association that represents private hospital groups, and obviously within the hospital groups are also all of the constituents that we represent, all of the independent healthcare practitioners. So we engage over time with policymakers from the Department of Health to all the various regulators, and we engage obviously across the health spectrum, medical schemes, doctor groupings, on how it is that we inform sustainable healthcare policy. And what you find in a conference like this is we continue to engage on how it is that we create sustainable healthcare systems.
So let's just then get a sense of how then we are hoping to achieve all of these things with the role players that are getting here today, looking at various of these issues that I outlined as well. 17 years of the work of HASA. What are some of those issues that you've been picking up that even to date worry you?
So what this conference is normally about, the agenda of the HASA conference is normally quite robust in terms of health policy. And what that implies is that we're pretty dependent on the regulator to ensure sustainability of healthcare. And we've taken a slightly different approach this year. In this year's agenda, you'll see that we've actually introduced a significant element of technological disruption. And what that tells you is we're saying that we actually believe increasingly that the improvements and the dislocations that are coming in healthcare that will improve access and equity in healthcare maybe is not dependent on the regulator. Maybe it's increasingly in our gift because of the innovations that we're seeing as a result of AI, genomic sequencing, wearables, robotics. So we're seeing significant improvements in access to healthcare that weren't around 5 years ago. And we're introducing those topics today at the HASA conference.
Who do we have here in terms of various of these role players? I know earlier on you had the MEC for agriculture here in Gauteng, MEC Ramogopa, but I see that there are various of the CEOs of various of these hospitals that are here today.
Yeah, so we have a very diverse grouping of people. You wouldn't normally expect to see the MEC for Agriculture in the audience, but she actually speaks to health policy and what informs good health policy. So we're actually open to very diverse voices. Yes, you do see CEOs of hospital groups. You also see that the Ombudsman for Healthcare is in the room. You see medical schemes in the room. You see CEOs of hospitals themselves, as well as public hospitals, private and public hospitals. You see actuarial firms. You see a broad range of players all trying to inform healthcare. There's a lot of players from the nursing environment, a lot of players from allied health. So yes, a very diverse group of individuals here.
A lot of talk as well around leadership and where we would want to see this space in terms of whatever challenges that they are navigating, centered around leadership. Looking at all of these issues that are playing themselves out in the public space, for instance, Tembisa Hospital, what we can learn from there, where procurement is concerned, where supply chain management is concerned. Are these some of the issues that you know more or less you are picking up from the public sector to say we wouldn't want to repeat in the private space where we find you operating mostly, especially issues of PFMAs and corruption that may even find itself within your shores?
So those aren't topics that we have on our agenda. Our agenda tends to be more policy-driven, more macro-driven, more innovation-driven. So you wouldn't find those type of topics on our agenda at this stage.
The NHI?
The NHI, historically, our agenda has been so full of NHI. For the last 12 years, it's been NHI, 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 universal healthcare. And I think we've reached a stage where that is in play. So the Act, as you know, has been signed. Currently, unfortunately, there are 8 applicants in terms of court processes on the various regulations, and we'll let that play out. What we're doing today is we're speaking about how it is that we find each other, how we continue to contribute to South African healthcare systems, even outside of NHI. How do we as leaders continue to contribute? How do we continue to find each other in a data-driven, evidence-based way? So the topic of this policy is less NHI rich than it has been in historic periods, but it continues to be informed by how it is that we contribute to our health system.
Yeah, what do we leave this conference with? What are you hoping to achieve? At least something that would say to you that it was a success, looking at all of these years that you've been hosting this conference. What says to you that we have moved a bit as well? Because some of these gatherings, you'd hear people saying there would be talk shops, and on the ground, the reality is that the status quo remains the same. So what is it that we are hoping to achieve getting out of this particular conference in the 2 days?
For me, the definition of success after this conference is that people walk out and they understand that they actually have more agency to effect change than they think. We don't need to rely on policymakers and policymakers alone. So we do know that there are weaknesses in terms of our health reform, but we've been waiting for that for so many years to change. And what we're saying now is actually there's so much in our hands that we can effect change. We've got to improve access to healthcare. We've got to be able to lower the price of care and increase the number of people that we serve. And we've got to continue in those journeys. And we can't postpone that. We've just got to continue with the initiatives that we have at hand. Right. And that would be the definition of success.
Awesome. Melanie, everything of the best in the coming 2 days. Melanie Costa joining us this morning as the chairperson, the chairman of HASA. And she's just giving us a sense of how more or less we can expect the 2 days to go about. But there are already those high-level conversations, Ayanda, that are taking place on the ground. On the other side as well, there are exhibitions that are taking place. So this is proving to be a 2-day of robust activities centered around the provision of adequate healthcare in the countries. Back to you in studio for now, Ayanda.
Katlego Legodi left to us there from Sandton in the north of Johannesburg for now. Thanks very much indeed.